to Nursing News Live. Today's special report focuses on infective endocarditis, a life-threatening heart infection that nurses must act on fast. We'll be watching a video presentation created by Group 20 in NURS 2213, which explores this condition in depth. Stay tuned as we uncover infective endocarditis from its symptoms to the critical steps that can save lives.
On one of my clinical rotations, I was assigned a patient diagnosed with infective endocarditis.
What is that?
What is infective endocarditis? Infective endocarditis, also known as bacterial endocarditis, is a serious infection of the endocardium, which is the inner lining of the heart, including the heart valves. It is caused by bacteria that enters the bloodstream and settles in the heart lining and/or a heart valve.
What risk factors should we watch out for in our patients?
Risk factors include advanced age. Adults over 60 face an increased risk of endocarditis. Poor oral hygiene, gum disease, or dental infections can allow bacteria to enter the bloodstream, potentially affecting the heart. Medical procedures, invasive procedures such as dental work or surgeries may introduce bacteria into the bloodstream. Intravenous drug use, using unsterile needles significantly raises the risk of bacterial entry. Structural heart conditions, congenital heart defects, prosthetic heart valves, and prior episodes of endocarditis increases vulnerability. Internal cardiac devices, pacemakers, or other implanted devices provide surfaces for bacterial colonization. And lastly, immunocompromised state where conditions such as diabetes, cancer, or HIV weaken the body's ability to fight infections.
Hold up. So what's the pathophysiology behind all of this?
When bacteria enter the bloodstream, often through a wound, dental procedure, or IV drug use, they look for a place to settle. These bacteria form clusters called vegetations, which contains platelets, fibrin, and immune cells. But the immune system struggles to fight them because they are shielded within the vegetations.
The pathophysiology. Damage or abnormalities in the endocardium can lead to a buildup of fibrin and platelets forming clots. Bacteria and other infectious agents such as staphylococci, streptococci, enterococci, or pneumococci can enter the bloodstream and infect the clot and heart lining. Fungi like Candida and Aspergillus, as well as other organisms, may also be involved. The infection typically causes the accumulation of platelets, fibrin, blood cells, and microbes into clumps called vegetations on the endocardium. These vegetations can break off and travel to other parts of the body. As the infected clot grows, it becomes shielded from the immune system by new layers of fibrin and platelets. The infection may then spread into deeper heart structures, such as valve leaflets, leading to damage such as tears, valve dysfunction, prosthetic valve detachment, or abscesses.
Clinical manifestations of infective endocarditis encompass a wide spectrum of systemic and cardiovascular symptoms. These include chest pain, new or worsening heart murmurs, persistent fever, dyspnea, flu-like symptoms, profound fatigue, cutaneous manifestations such as ulcer nodes and Janeway lesions, as well as peripheral edema, abdominal distension, hematuria, and splinter hemorrhage.
Doc, I've been feeling awful. Fevers, chills, and this chest pain that won't go away. I thought it was just a cold.
And have you noticed any unusual spots in your hands or a persistent murmur?
Murmur? I mean, my heart does race sometimes.
Let's check your heart and run some tests. We need to rule out infective endocarditis.
Diagnosis is usually confirmed through a blood culture and an echocardiogram. Additionally, the Duke criteria is used to help identify endocarditis clinically and microbiologically. So, diagnostic evaluation. Echocardiogram. Sound waves produce images of beating heart, allowing assessment of how effectively the heart valves and chambers pumps blood. This test also provides insight in the heart structure to aid in diagnosing endocarditis. Healthcare professionals may use two distinct types of echocardiograms. So, the blood culture test. This test aids in detecting blood-borne pathogens. The choice of antibiotics or combination of antibiotics for treatment is particularly determined by the test results. For a complete blood count, the test can detect a high number of white blood cells, which may indicate an infection. It can also diagnose anemia, reduction in healthy red blood cells, which may be a sign of endocarditis. For chest x-ray, a chest x-ray reveals the condition of the lungs and the heart. It can also help determine whether endocarditis has caused cardiac enlargement or if the infection has spread to the lungs.
Based on the Duke's criteria, to confirm a diagnosis, the criteria are divided into major and minor categories. For the major criteria, this involves positive blood cultures as well as endocardial involvement. For the minor criteria, this involves predisposing factors, fever, vascular phenomena, immunologic phenomena, as well as microbiological evidence. Based on the results, the diagnosis can either be definite infective endocarditis or possible infective endocarditis.
Okay, Ms. Smith. Based on your results confirming infective endocarditis, I have two recommended approaches for medically managing this condition. One is empiric antibiotic therapy. When infective endocarditis is suspected, empiric antibiotic therapy should be initiated promptly. A common regimen includes vancomycin or ampicillin sulbactam, often combined with an aminoglycoside to provide broad spectrum coverage, especially against resistant organisms. Surgery may be required when infective endocarditis causes structural damage to heart valves, leading to regurgitation or obstruction. It is particularly indicated in cases involving fungal infections, resistant pathogens, or persistent bacteremia lasting beyond 1 week of appropriate therapy.
So, how do we manage a patient with this condition as nurses?
Based on my experience, there are various nursing management strategies for ineffective endocarditis. However, I will discuss three key nursing diagnoses and their corresponding interventions. First, nursing diagnosis: risk for ineffective cerebral tissue perfusion or risk for stroke. Definition: susceptible to a decrease in blood circulation to the brain. So interventions: monitor for neurological symptoms such as weakness, slurred speech or confusion, assess for embolic signs including hematuria, petechiae, or cyanosis, report new heart murmurs which may suggest valve involvement and potential embolization, assess peripheral pulses to detect signs of compromised circulation. Second, nursing diagnosis: risk for decreased cardiac output. Definition: susceptible to inadequate volume of blood pumped by the heart to meet metabolic demands of the body, which may compromise health. Interventions: monitor vital signs including heart rate, blood pressure, and oxygen saturation. Assess for new or changed heart murmurs and signs of heart failure. Administer vasodilators as prescribed to optimize cardiac function, and encourage rest and activity modification to reduce cardiac workload. Third, nursing diagnosis: anxiety. This is an emotional response to a diffuse threat in which the individual anticipates non-specific impending danger catastrophe, or misfortune. Interventions assess the patient's level of anxiety and coping mechanisms, provide clear, reassuring explanations about the condition and treatment plan, encourage relaxation techniques such as deep breathing or guided imagery, and offer emotional support and involve family members in discussions.
Complications of infective endocarditis include pulmonary embolism, stroke, kidney damage, damage to distal extremities such as fingers and toes, and an enlarged painful spleen. We must act fast. Complications can be fatal.
Good morning, my name is Miss Stewart and I'm a public health nurse. Today, as a part of our daily health education session, I will be providing essential information on the prevention as well as the awareness of infective endocarditis, a serious heart infection. Maintaining excellent oral hygiene, scheduling regular health checkups, leading a healthy lifestyle, and recognizing your symptoms early are all crucial for prevention. Now, when we look at emphasis on oral hygiene, we must advise patients to maintain excellent dental health by brushing and flossing regularly and scheduling routine dental checkups, which is crucial because bacteria from the mouth can enter the bloodstream. Good dental hygiene is especially important for patients with valve problems or prosthetic valves as it helps to reduce the risk of this infection. 2. Recognizing symptoms. Now, recognize early symptoms as discussed before and seek medical help. Timely treatment is crucial in preventing complications. Now, getting enough rest. It's important to schedule time every day for rest and relaxation. Rest times are essential because they give the heart a chance to pump more easily. Regular heart checkups and lifestyle changes. Now, regular heart checkups, individuals with heart conditions should have routine cardiac assessment. Lifestyle changes, this supports immune function and cardiovascular health. Your heart is precious. Protect it by staying informed and seeking early treatment.
That's our report on infective endocarditis. As nurses, we are the front line in recognizing and managing this silent killer. Until next time, stay informed and stay heart smart.